Since 1983, FAME has helped business and education work for Maine. Contact the authority, the Finance Authority of Maine. You're watching Mainebiz Sunday, Maine's business news source.
Michelle Hood came to Eastern Maine Healthcare Systems as CEO in 2006. Since then, she gained a reputation as a team player who forges working relationships with Maine's other healthcare providers. In 2009, under Hood's leadership, Eastern Maine Healthcare Systems helped turn around the troubled Down East Community Hospital in Machias and won a prestigious national award for patient safety. Please welcome Michelle Hood, the Mainebiz 2010 Business Leader of the Year in the large business category. Welcome.
Thank you.
Congratulations.
Thank you very much.
That's great. That's cool. I love this time of year when we get the Business Leader of the Year awards come out. I get to meet these really leaders in our state. And from the profile I read about you, you really fit that bill. So I'm glad you're here. Great. Yeah, you're a large business category leader, and large indeed. I mean, I didn't realize Eastern Maine Healthcare Systems covers 70% of the land mass in Maine and 40% of the residents. What kind of challenges does that pose in terms of running a hospital, a healthcare system, or any business for that matter?
Well, I think it certainly has its unique challenges from the standpoint of that, healthcare is a personal relationship kind of service, and we have to have that ability to meet patients and their families where they are, and when they're distributed over such a large geography, it makes it a little more difficult, a little more challenging, and so we have access points scattered all over the northern two-thirds of the state, and that makes the cost structure a little bit more difficult because of that need. But we're getting very creative in that regard. We're connecting people with technology, and we're utilizing our resources, I think, very efficiently at this point.
Good. Big system. How many employees total do you in that whole system?
A little over 8,000 employees.
Whoa!
Yeah.
Really?
Yeah.
I didn't realize that. That's amazing.
Yeah.
That is amazing. You came to this job from Montana.
Correct.
Billings, Montana?
Lived in Billings, worked all over the state.
Okay.
Yep.
How do the two states compare? They're kind of rural populations. Do they have the same issues in terms of healthcare service delivery and costs and all that stuff?
A lot of similarities.
That's why they brought you here?
I don't know about that, but there certainly are a lot of similarities between the two states, and the most obvious one being the rural nature of the geography and the demographics. I think there's also a really strong common thread between the two states because of the populations and the characteristics of the populations themselves. From the standpoint of in the West, you get that kind of that pioneering spirit, that Wild West, we can do anything spirit. And in Maine, I think we see the same thing. We see that Yankee entrepreneurial ingenuity. We can do anything that we set our mind to. So that common roll up your sleeves and get it done kind of approach is there.
What surprised you about Maine?
I think the distinctive nature of the state and having really 4 different regions, and they're very different. We have hospitals in 3 out of 4 of the regions, and so I get to work with the boards of directors that represent those communities all over the state. And while they're very much Mainers, no matter if you're on the coast or in the mountain areas or up in the Greenville Lake area. There are certainly different challenges and different resources that are brought to bear. So that was one surprise, is just getting to know the various communities that we serve. And I think one of the surprises was the need to really be intimately involved with the state legislative process in a way that I certainly have been involved in policy making and legislation in the states that I've worked in the past, but I think Maine has a particular challenge around the Maine care population, and that drives so much of the policy making and so much of the decision making in Augusta that was a bit of a surprise.
And we're going to talk more about Maine care and all of those issues in a minute too. One of the things with that came out in the profile that they wrote about you as a winner of the Business Leader of the Year award was your focus on collaboration, your real need, and you bring that experience with you, the need to kind of work together.
Absolutely.
One of the quotes we have for you is that you said, "There's not enough resources to go around. I consider it a waste of resources when there's competition." Tell us a little more about that philosophy.
Well, I think that, I certainly believe that to be true, and particularly I guess I would qualify it by saying it's a waste of resources when there's non-productive or non-positive competition. I think there can be competition, and there should, because I think that drives people to be better.
Right.
I mean, even within our own system, we have competition. People are trying to do better than their colleagues, and I think that that's healthy and can drive excellence and drive improvement. But when you're competing with each other in an unhealthy way, when the resources are so scarce that I just think that there's not enough to go around, and so we've got to figure out how to put the pieces together so that we maximize the impact for the patients and their families.
Right. I was also interested to find out that one of Eastern Maine Healthcare System's goals that you've set, come here and been very aggressive, is to become the country's best rural healthcare system by 2012.
Correct.
That's, you know what year it is? It's
yes,
2010.
We're getting there, I know.
You're getting busy, I hope. Is that achievable? And
it is.
My follow-up question is going to be, what if you don't make that?
Well, it is achievable, and believe me, I've got 152 board members across the state who work with us that are always asking that question. Not just is it achievable, because they all bought into it, all of our leadership bought into the goal when it was set several years ago. But the question always is, how will we know when we're there? How will we know when we, when we've achieved that? So we're very metrics driven, and we use a planning and performance management platform that goes, it's kind of a balanced scorecard approach, if you've heard that term in the past. So we measure ourselves in 6 categories of performance, and we plan and set our strategy in those 6 categories. So we've said that we can tell when we've reached our goal when we're performing in the top couple of decile in each of the metrics in each of those 6 pillar areas.
Okay. Kind of related to that, I mean, you've been also quoted as saying that, quote, leadership has to be consistently transparent. You can't just be transparent when it's convenient for you to do so. Tell me more about what that means as far as your leadership style, and also how did you use that transparency for the hard decisions too? I mean, you recently had there were some layoffs of 50 employees at Eastern Maine Medical Center, and another 30 positions eliminated at Blue Hill Memorial. Right. So how did that transparency play into that? Well,
it starts with being very open about how decisions are made. And decisions can't always be made through a consensus building approach. We hire good people with expertise in particular areas, and I expect them to use that expertise to drive performance and to make decisions. So although the process itself is not, I guess I look at Washington, D.C. right now, and the idea that C-SPAN is in the room where the debate is going on. We don't have open meetings in that kind of regard, but we're very clear with our boards and with our leadership and with our employees about how decisions will be made. And I think that the trust building that comes about by describing the challenge of the decision and what the process that was used in order to make that decision continues to build trust, so that people know that we're going to be deliberative, we're going to be data-driven, we're not going to be reactionary, we're going to give it careful and thorough thought. It's
that balance of both, the transparency, but then decisions have to be made. And
Exactly.
We're going to wrap this segment right here, but we are going to keep you around for an afterthought segment, and we want to talk about, I really do want to talk to you about the Down East Community Hospital, how you turned that around. It was an amazing story, and how you decided to even become involved in that as a receiver. I mean, that's pretty risky business for just coming on board. So stick around, we're going to talk more about that. And Medicaid, and we're going to get you to weigh in on the national health care debate.
Okay.
Great. Thanks. And congratulations again.
Thank you.
You can catch more of this discussion, our exclusive Afterthought segment, seen only on the web. Go to mainebiz.biz and click on the Mainebiz Sunday link. We'll be right back.
Mainebiz Sunday is made possible in part by funding provided by the Finance Authority of Maine.